Hello everyone. Today we'll discuss about Gaucher disease, mainly from the IAP recommendation guidelines. Okay. So starting off with the introduction, it is the commonest lysosomal storage disorder. So it is one of the commonest lysosomal storage disorder. First. Secondly, it occurs due to deficiency in acid beta glucosidase enzyme. So occurs due to deficiency of acid beta glucosidase. So due to this deficiency, there will be an accumulation of glucocerebroside in lysosomes. This leads to accumulation of glucocerebroside in the lysosomes. This leads to a multi-organ dysfunction. Okay. So this affects the multi-organs. So this is the main cause of our Gaucher's disease. Next, going into IAP recommendation, starting off with the investigation. First is enzyme diagnosis. The enzyme deficiency here is beta glucosidase, that is beta glucocerebrosidase, that is present in the leukocytes. So gold standard for diagnosis is enzyme diagnosis. That leads you have to look for beta glucocerebrosidase enzyme assay in the blood leukocytes. So in patients with Gaucher's disease, the level will be less than or equal to 10% of the control. Fine. This is the first investigation. Second recommended investigation is molecular diagnosis. So in molecular diagnosis, you will be finding the gene mutation. So that is identification of mutation. So identification of GBA mutation. So when there is a mutation in GBA, it helps to confirm your diagnosis. It confirms the diagnosis. Okay, not only in confirmation, it also helps in prognostication and in for a prenatal diagnosis and also for carrier testing. Okay, so since in India the Gaucher's disease is due to the high prevalence is mainly because of L44P mutation. Okay, so when you find a L44P mutation in a child with the symptoms of Gaucher's disease, it confirms the diagnosis. If there is no LPP4 mutation, next you will be going for complete genome sequencing or complete evaluation you have to go for. That is full sequencing of the entire coding regions of GBA. That helps in confirmation of your diagnosis. Next, we have biomarkers for Gaucher's disease. So this biomarkers can be a separate question in your recent advances also. So biomarkers in Gaucher's disease. So the two main biomarkers are, first is chitotriosidase and second one is CCL18. This chitotriosidase and CCL18. So actually this both will be elevated in patients with Gaucher's disease because these both are produced by the Gaucher cells. So it represents the body burden of Gaucher cells. Among these two, this chitotriosidase, this is the main biomarker which is being secreted by Gaucher cells. Okay, this chitotriosidase will also be elevated in other lysosomal disorders and even in thalassemia. But in children with Gaucher's disease, the elevation will be more than 1000-fold. Okay, so you have to remember the biomarkers are chitotriosidase and CCL18. In that, main is chitotriosidase, which can be elevated in even in other lysosomal disorders and even in thalassemia also it will be elevated. But in patients with Gaucher's disease, it will be more than 1000 times elevated. And I have to tell you one more thing. You all know about the classification of Gaucher's disease according to their clinical features. There are 3 types. In this, type 1 is non-neuronopathic. Type 2 will be acute one, and mainly it is an infantile type. Type 3 is a subacute and a chronic one, and it is non-neuronopathic. It is neuronopathic. So in type 2 there will be an involvement of CNS, that is they'll have bulbar palsies, like that thing. Okay, in type 3 also there will be a neuronopathic involvement, but it will be a progressive one. This type 3 is again can be classified into type 3A, 3B and all. Okay, and 3C. So it is according to their progression. But in type 2 you will be having bulbar and oculomotor paresis. So this is a general classification of Gaucher's disease. So non-neuronopathic, acute and infantile, third will be subacute and neuronopathic one. Next, I'll go on to a treatment. So this treatment is a separate topic or separate question in your examination. So there will be a disease specific management. So disease specific management includes, first one is enzyme replacement therapy. It is a priority question, this enzyme replacement therapy. Okay, second one is substrate replacement therapy. First we'll discuss about this enzyme replacement therapy. So there are criteria for this enzyme replacement therapy. So we'll see the criteria one by one. So when the child has one or more of the following, which I am going to tell, you can give an enzyme replacement therapy for that patient. First, failure to thrive, that is height and weight will be less than 5th centile for age. This failure to thrive is mainly because of Gaucher's disease and not due to some other reason. Okay. Second, the child will have splenohepatomegaly causing mechanical discomfort. This is causing mechanical discomfort, or when there is a splenic infarction. Okay. Third criteria is severe cytopenia. Even bicytopenia can be also taken into a criteria. In severe cytopenia, when the child has HB of less than 8, platelet count of less than 60,000 and leukocyte count, that is total count, less than 3,000. So HB less than 8, platelet count less than 60,000 and total count less than 3,000. Fourth criteria is symptomatic bone disease. In symptomatic bone disease, when the child has the symptoms such as bone pain or bone crisis, or when the child have an active bone disease. Okay. Fifth one is when the child has a prior splenectomy. The child has a prior splenectomy. Sixth, when the child has a symptomatic pulmonary involvement. So these are the criteria for a child with Gaucher's disease to start on with the enzyme replacement therapy. So what are the FDA approved enzyme replacement therapy? So FDA approved enzyme replacement therapies are, first one is imiglucerase. Second one is velaglucerase alpha. Third one is taliglucerase alpha. So these three are the FDA approved enzyme replacement therapy for children with Gaucher's disease. Next, how do they administer enzyme replacement therapy? Administration. This is a lifelong therapy. So they should be discussed with their parent, genetic counselor. So it is a multimodal approach, the treatment for this Gaucher's diseases. So it's a lifelong therapy. It is administered as intravenous. infusion, and it is given once in every 14 days. The dose here is 60 international units per kg, 60 units per kg is the dosage for enzyme replacement therapy. Okay, this enzyme replacement therapy is mainly considered in children with the Gaucher's disease of type 1 and type 3. In type 3 also, if it is a progressive neurological disorder, it is not being used. It is mainly used for children with visceral, hematological and skeletal management. Okay, since this enzyme replacement therapy does not cross blood-brain barrier, so it does not cross this blood-brain barrier, so it is not being recommended or not used in type 2 Gaucher's disease. Okay, so this is about the enzyme replacement therapy. Next will be what are the treatment, when you give a treatment for that child, what are you going to monitor, or what are the therapeutic goals? So I'll write few of the therapeutic goals. So therapeutic goals of giving this enzyme replacement therapy is first, anemia. There should be a correction of anemia. So there will be an increase in the HB of more than 10 gram per deciliter, and it will eliminate the blood transfusion dependency. Second, thrombocytopenia. In thrombocytopenia, there will be an increase in the platelet count to prevent the surgical obstetric bleeding and all. So the baseline platelet count will be between, so the baseline platelet count will be between 60,000 to 1,20,000. Okay, or it can approach normal levels, or the platelet count can increase by 1.5 to 2-fold. Third, hepatomegaly. In hepatomegaly, you can expect a decrease in the liver size. So there will be a decrease in the liver size, or there will be a reduction in the liver volume. So there will be reduction in liver volume by 20 to 30%. Okay, next in spleen. You can avoid splenectomy in all patients, plus there will be a reduction in spleen volume by 30 to 50%, and by 50 to 60% also. Plus it can eliminate the symptoms such as abdominal distension, early satiety, splenic infraction can be reduced, which can you see in the ultrasonogram. Okay, next, in bones, it can lesser or it can prevent the bone pain and bone crisis. So it can prevent bone pain and bone crisis. Okay, and it can also prevent the fractures. Sixth, growth. In growth, the child can achieve a normal height and weight. So child can achieve normal height and weight, and the quality of life can be improved. Plus the first goal will be the symptoms, the feeling of well-being. You have to write this, feeling of well-being. There will be decrease in fatigue, irritability, and decreased abdominal distension. There will be improved appetite. As we see in a child with tuberculosis, when we start on this ATT drugs, the child will have the feeling of well-being, improved appetite, there will be increase in weight and everything. So such types of symptomatic relief will be present when a child receives an enzyme replacement therapy in Gaucher's disease. Okay, so this is about the new recommendation which can be asked in your recent advances paper. Okay, so I've told about only the main picture here. I have not gone into a detail of this Gaucher's disease. Okay, thank you. In next video, I will post the probiotics in newborn.